Mr. Just, so तुमसे just introduction देते हैं and then we'll start. So good evening everybody. Welcome to another session. Well, आज हमारे साथ जुड़े हैं मुंबई से डॉक्टर नितिन कोचर सर. सर पिछले 29 इयर्स से मुंबई में प्रैक्टिस कर रहे हैं. सर एमडी आयुर्वेद हैं एंड क्लिनिक के साथ साथ सर ने काफी फार्माकोलॉजिकल एंड कैंसर इन चीजों में रिसर्च वर्क में बहुत काम किया है. सर डिपार्टमेंट ऑफ क्लिनिकल फार्माकोलॉजी KEM हॉस्पिटल में
And
सर
pharmacology.
काम.
There are two departments.
ओके
Clinical
सर,
pharmacology
क्लिनिकल
and
फार्माकोलॉजी
pharmacology.
एंड फार्माकोलॉजी ऑफ KEM हॉस्पिटल
Yes.
सर वहाँ पे काम सर ने किया है. साथ ही साथ सर ने टाटा मेमोरियल हॉस्पिटल में क्लिनिकल ट्रायल्स ऑन सेफ्टी एंड एफिकेसी ऑफ कर्क्यूमिन, अश्वगंधा एंड कैनबिस इसमें सर ने काम किया. एंड सर साथ ही साथ ऑनररी कंसल्टेंट है एट यूनिवर्सिटी ऑफ मुंबई एंड श्रीमती कमलाबाई मित्तल आयुर्वेद हॉस्पिटल चेन्नई रोड. सर के 29 इयर्स ऑफ एक्सपीरियंस में से आज सर इस तरह से शेयर करेंगे कि किस तरह से रूट कॉज ऑफ कैंसर इसे हम समझ सकते हैं, उस हिसाब से कैसे दवाई की करनी चाहिए. आप सब चाहूंगा कि चैट बॉक्स में CCC टाइप करके सर का वेलकम करें एंड ओवर टू यू सर.
Yeah, thanks Rahul for inviting me to your esteemed platform. And I know topic is little difficult, so not many people are actually interested to work on cancer. But believe me, this is the one disease in which if we put efforts. Hello, am I audible? Hello, am I audible, Rahul?
Yes sir.
Okay. So this is one disease in which if we put efforts, it will definitely contribute to the society and also will, improve your practice. Okay. Yeah. So first of all, my sincere thanks to all Ayurveda doctors and teachers like Vaidya Shri Lata ji, late Vaidya Shri Goradia ji, Vaidya HP Sharma ji, Vaidya Rakesh Sharma ji, Vaidya Ranawat ji, Dr. Ashish, Dr. Vishwajit, my colleague, Dr. Nitin Goradia, Dr. Hina Bhatt, my Goreka Medical Association family, my family members, my patients, and above all, Lord Dhanvantari. And from modern doctors and scientists, Dr. Devchan Gala, who is MBBS but then doing pure Ayurveda practice, he had immensely guided me to do proper Siddhantic Ayurveda practice. Dr. Ashok Vaidya, who is a giant personality, and he has actually done a lot of contribution to make Ayurveda more scientific in the modern vision. People started believing him after his lectures and his presentations, and he has published number of papers. He has actually trained number of modern doctors like Dr. Nirmala Rege, Dr. Nilima Kshirsagar. They are the giant again pharmacologists. So Kshirsagar madam was a dean. At that time, I was working in KM hospital. Dr. Rege madam, she was a professor, head, and also looking after Ayurveda OPD. Dr. Banavali from Tata Hospital, Dr. Manish Agarwal, I cannot forget him throughout my life because he is the one who started the Curcumin and Ashwagandha trial in India in Tata Hospital. Otherwise, this trial would have gone in the hands of USA or other Pittsburgh University. Dr. Pankaj Chaturvedi, with whom I am working at present on cannabis safety and efficacy, Dr. Pankaj Chaturvedi and Dr. Shalaka Joshi. Dr. Vikram Gota, again from Attract, then Dr. Manu Lopus from Mumbai University, with whom I had an opportunity to work on gold nanoparticle, Dr. Lal Hingorani. I'm indeed thankful to him for providing me the standardized herbal extract of the best quality and also to be a part of Curcumin and Ashwagandha trial. I'm also thankful to Dr. Nitin Goradia for giving me best quality of herbal medicine without any compromising on the quality and all. Then another personality, Dr. Mitali Mukherjee, one must interact with her. I'm also planning to arrange one session on genomic and Ayurveda. So she has done a great research, and it will really give us insight on how this Vata, Pitta, and Kapha are to have molecular targets. It will be, we are many a time we are asked that what is Vata, Pitta, Kapha? Do you have any evidence? So she is the lady who has actually, shown what is actually Vata, Pitta, and Kapha and how we can prove it in the molecular biology and in the laboratory. Then Dr. Syed Tahir Hassan, he has trained me for cannabis. So, with the help of all these doctors and scientists and God, I am able to do some work. So, if you like it, all credit goes to these people. And if you don't like it, the shortcomings is totally upon me. Thanks. My introduction as already done by Dr. Rahul. I had an opportunity to work in KM Hospital, Tata Hospital, and so on and so forth. Recently, Just a minute. Wait, your mobile has to be here, na? नहीं ऐसे भी से लो. Current slide. So these are the राहुल हे वरचा बँड कसा काढायचा?
कोणता म्हणतात सर?
This black band, mute, stop video.
सर नाही तो दिसणारच. तो
Journals, modern
दिसणारच सर.
journals. Okay. These are modern journals from where I have all the references for our principle and also for the foundation area of work. Just not auditing because of the internet. I will never know. So these are the list of the journals. These are the best of the PubMed Index journal from where I have got all the references. Okay. Now, friends, why we should work on cancer? The basic question. So cancer, the current scenario is very, very bad. Currently almost as per the American Cancer Society, there are almost 1,500 people are dying. 1,500 people, this is American Cancer Society data, and one equivalent are probably it may be more, 1,400 deaths per day. This is our National Institute of Cancer Research Project India. Now, surprisingly, more than 90% of this death in cancer is due to metastasis and the spread of the disease, relapse of the disease, and not due to the primary tumor. So, in spite of patient has taken proper chemotherapy, surgery, radiation, there is a high rate of relapse and recurrences and metastasis. Unless there are very few lucky, those who are diagnosed in a very early stage and treated, in those cases, relapse and or is always diagnosed in second, third, or fourth stage. So, number of people who are dying because of the cancer are they in a little advanced stage? Those who have missed the diagnosis and there is a relapse and spread. Those who are chemo resistant. So, we Ayurveda doctors definitely can play a very important role in preventing this relapse and spread or the metastasis of the cancer. So, what I always say that early diagnosis, yes, it's a thumb rule. Okay. Medical treatment, surgical treatment, radiation. Okay. Medical treatment like chemo, hormonal treatment, immunotherapy, whatever. So I'm not interfering into any of these modern conventional treatment. Okay. Medical legally, I cannot say no to the patient that don't go for this treatment. And we all should abide by these rules and regulation for our own safety. Okay. So what is missing is the chemo prevention, the treatment which prevents the initiation, the growth, and the proliferation of cancer. This is the most important fourth pillar of the treatment, and we are lucky that being an Ayurveda consultant, we can give this treatment. Now, scientifically, whether this treatment is proven, case papers are published, this, that, these kind of number of things are being asked. But believe me, a lot of research is being done and efficacy of herbal medicine has been established in the cancer. We will see in our due course of our presentation. And I'm sure in our first few slides itself, you will agree with me that what kind of Ayurveda treatment we can give. As it is written in Charaka, Anuhi Bhutva Rogam Paschat Vivardate Sajat Mulo Pushtati Balam Ayushya. So when this is in an early stage, you have to diagnose and treat before it, kills you. So this is something called, onco prevention. So normal cell getting converted into the cancerous cell by oncogenes or some kind of carcinogens, which are like say for somebody is ingesting tobacco, and those carcinogens are stimulating normal cell to become initiating cell. So there are certain medicine which will prevent this kind of, the carcinogens. Now, if cancer process has set in and it is growing, it is growing, the cancer cells are growing. So there are certain medicines are there, herbal medicines are there, which prevent and which block cancer at the pre-neoplastic cell stage. Okay, another opportunity we got. Unfortunately, if we miss this, again, those who are full-blown cancer and those who are on a chemotherapy, you give Ayurveda medicine, diet, everything as an adjuvant. And again start, because we know that cancer doesn't stop here. One can remove the cancer mass, one can irradiate the cancer mass, but again, the cancer process has not been arrested. You have to arrest this initiation, promotion, and progress. And for that, what kind of things we can do? Let us see. Now, is it is it advisable? Is it legal? Okay. So, do I have any kind of scientific basis to say? So this is the paper from Lancet Oncology, that chemo prevention. Now, chemo prevention does not mean only herbs. It's a total lifestyle change. Okay, so you have to screen the patient, you have to screen the society, you have to screen the mass, all those kinds of markers, BRCA, etc., one or two, and all other things, whatever we can do. Identify the people, change their lifestyle, because lifestyle makes very, very big impact on the cancer process. So, like that, this kind of pyramid we can build. So, this is called primary prevention. Then, secondary prevention, those who have pre-invasive dysplasia or pre-neoplastic, so to them to give certain herbal medicines, or again and prevent them from becoming a neoplastic stage, like I explained in my previous slide. And ultimately, unfortunately, those who are already having cancer and they are taking cancer treatment, you give them your tertiary chemo prevention so that there is no relapse. You give medicine to improve immunity, you give medicine to stop the cancer process. Okay, this is how. Medical legally, can we give it? So WHO strategy, if you see for 2014-34, which clearly states that traditional medicine of proven quality, safety, and efficacy. Most important, proven quality, safety, and efficacy contribute to the goal of ensuring all the people have access to the care. So we are even having legal, or we are backing from the WHO. We need to only harness the potential. We need to prove the safety and efficacy. Okay, and then you can safely use it in your practice along with conventional health system, whatever people are taking chemotherapy surgery. If doctors are saying there is no need of giving chemotherapy surgery, or there is no point, in such cases, you can take the informed consent of the patient and you can continue your own medications. Now, coming to the cancer. So human body is a super intelligent, beyond any kind of understanding of artificial intelligence. So there are almost 36 trillion cells are there which are working in a coordination with each other, to so that we can do our live our life, and we can achieve our all kinds of duties, okay, for which we have taken the birth. So all these 36 trillion cells, they are produced in a controlled manner, absolutely in a controlled manner. Okay. Now, during the process, there are number of checkpoints are there. If they find any kind of abnormal cell, those cells are removed by your immunity. They are also subjected to the self-death called apoptosis. Okay. So this kind of controlled growth and bounded proliferation and functioning gives you health. But in cancer, there is an uncontrolled production. These checkpoints are abnormal. The checkpoints are not working. The system which checks abnormality, fails because of XYZ reason. And it gives rise to uncontrolled production, and this kind of uncontrolled growth and unbound proliferation and causes abnormal functioning, and that we cause it's a cancer. So let us see what exactly happens. So friend, this is a very basic thing, but here itself you will understand that how Ayurveda can be implemented. Now this is a normal cell cycle. Okay, so every cell, it undergoes during the growth process. So there is a rapid growth, okay, G1 phase, what we call, in which the cellular material, except the nucleus, like mitochondria or Golgi complexes or protein, all these things, whatever things are there in intracellular organelle, they double up. Okay, there is a protein synthesis happens, and which is used for the DNA synthesis in the next phase. But between these G1 and S, there is a strict G1S is a checkpoint where it is checked that every intracellular organelle is developed properly. There is enough protein for the synthesis of the nucleus. Okay, then it goes to the S phase. From S, there is a DNA synthesis occurs so that nucleus also can divide and become two. Then in the G2 phase, there is a growth and final preparation. So all the intracellular organelle, they start dividing. There is a visionary, fusion. There is a fusion so that one cell can divide into the two. And ultimately, the cell divides in the 5 process called mitosis. Okay, and one cell give rise to two. If any abnormality is found, that cell again itself from the G1 is goes to the G0, that is the resting phase. Otherwise, it propels further. So at every junction, these are the checkpoints, and these checkpoints play very important role. Now, this cycle takes almost 24 to 25 hours. So G1 is almost say 6 to 12 hours. Okay, because of course it's the longest cycle. All intracellular organelles, they have to become double. The protein synthesis has to occur. Then 6 to 8 hours is the S or synthesized phase, and G2 where there is a visionary line occurs, and the cells splitting into the two. And the shortest is the mitosis phase. Now, here if you see Vata people, those who are having a Vata Prakruti, they have fast mitosis. Now, having said that, so it is very clear that what a person will be more prone for the metastasis and spread. So, if you are able to identify the prakruti of the patient, and if you see that this patient is vata, so you give medicine which will reduce vata, which could be anything, which could be Maharashtra Kada, which could be Bhunimbadi Vidaryadi Kada, which could be Jatamansa Kada, anything from Vagbhat or whoever from you like, as per his prakruti, identify this is a Vata person, and tell this patient. Also discuss with your modern people, they will be also surprised and amazed, and you can predict that this person is Vata person, is for the fast mitosis. Then Pitta person, they have a fast Jivan phase. Okay, that's why they are prone to relapse. Pitta is when it is abnormal. Okay, in that phase, whenever there is a production has to occur, Pitta plays very important role. And if Pitta is vitiated, so there will be a fast Jivan phase, and these people are prone to develop relapse. This is based on my personal experience, and I have tried to correlate the things, and I have observed things, and based on that, I am telling to you. Then Kapha people, they have, the slower. Now here, as you can see, the G is 6 to 12 hours. Okay, so Kapha will have maximum 12 hours. Kapha will have maximum 8 hours. Kapha will have G to maximum 4 hours. Vata may be having shortened. Pitta may be having little shorter this thing period. Okay, for the cell cycle. But Kapha will be always slow. And Kapha will be always having more prominent growth of elements in the G2. Okay, there will be more adhesion molecule. So this kapha people are actually chemo resistant because chemotherapy acts on who are fastly proliferating. The slow proliferating cells, they always escape the immunity and the chemotherapy. So kapha people are also chemo resistant. Remember this. So with that, for Vata you can use Maharasnadi Kada. For Vata you can use Vidaryadi. For Pitta you can use Bhunimbadi. For Pitta you can use, Vasa Dashanga Kada. For Kapha you can use Bharangadi Kada. Kapha you can use Mahamanjishtadi Kada. Aragvadadi Kada. So now there is no need to have any specific yoga. This is all common sense based on our the Vata constitution and the genomic correlation. Okay. So this is what I have observed and I am using it. So ultimately, once this G1, G2, GS, M phase are over, the new cells are born, which are identically twins. Absolutely, they are working normally. And like this, so on, so forth, our every tissue and every system work. Now, what happens in cancer? This is a cell division. If something is abnormal like this, what you can see, the green cell, this cell is made to die. This is called cell suicide or apoptosis. Okay, so there is no cancer. You will not believe that every day almost 50 lakhs such kind of cancerous cells are produced in our body, and body is greatly washing them out. We are thankful to our immune system and the self-repair system. So one mutation will not cause cancer, but so unfortunately, if this is missed from the immunity, or this is not filled, so what will happen that all these will go under another mutation, okay, third mutation, and ultimately fourth mutation. So God is giving you so many opportunities, to kill, but if they escape, and this is the fourth or the later mutation, which keeps on increasing in the size and number and proliferates, and all vimarga gaman occur, and they spread. Once disease reaches to this phase, you have to ask patient to take chemotherapy, surgery, radiation. Don't say no. In last 29 of years of my practice, I have not seen that Kanchana, Google or any other medicine is able to actually reduce the size of it. If small cancer is there, yes, but the big chunk, 10 centimeter, more than 10 centimeter, 15 centimeter, it is irrational to say that this will reduce simple by good. But what you can do, we can definitely prevent this oncogenic transformation of normal cell to cancer cell. You can prevent this kind of multiplication and growth and prevent proliferation of the cancer cell. Okay. So how this can we can do it? Okay, this is again here you will understand that now all these G1, S, G2, and M phases they require some kind of cycling dependent kinases. These kinases are very play important role. They promote, they proliferate based on the stimulus, based on the growth hormone. Okay, so these cycling dependent kinases are produced and they stimulate the G1 cycle, cyclin dependent K2. There are a number of things. So we have taken only few of them. Now, when I say cyclin dependent kinase, so there is a cycling, okay, which is again coming from the nucleus. Once the growth hormones or receptor stimulus, okay, stimulates the cell, stimulates the nucleus, okay, the messenger cell from the RNA, from the nucleus will produce this cyclin. This cyclin will stimulate cyclin dependent kinases. Since this cyclin dependent kinases will stimulate your cycles of G1, S, G2, and M. So if there is anything abnormality is there, body will immediately secrete a protein, major protein called P53 protein, as you can see. So these are the various molecules of P53 family, like P16, P21, P27, and P21. So if they find that if there is any abnormality in the intracellular organelle, immediately body will secrete P53 or family, and this will block the cycling dependent kinases and the cycle will be arrested. Okay. Once the cycle is arrested, the next phase that there is a repair. So there will be repairing of the abnormality. If the repair occurs, then this phase will go to the DNA synthesis. Again, checking if the repair is done, if it is there at all, then G2 phase and the mitosis. Okay. So like this, for every checkpoints are very essential. Now, number of herbal medicines in cancer, what happens? This P53 molecule is not working properly. Now, number of molecules, say for example, curcumin, it improves P53. So P53 family is improved by your curcumin. So you can use curcumin. Below works here at G2 phase. Okay, so this works beautifully at G2 phase and arrest from the mitosis. Okay, like that you can use number of herbs. There are references are available. So these are the multiple signals, cyclin dependent kinases, which I have given. Cyclin dependent kinases are stimulated by cyclin D. They are stimulated by CDC. They are stimulated by CAK. Okay, and they are prohibited. They are inhibited by P15, P16, P21, P27. So these are all P53 family. Okay. So they stop cyclin dependent kinases and do not allow the growth further. Okay. So this is the importance of checkpoint. You may find it, okay, because of the say any irradiation, any stimulus, if happens, okay. So there is a P53 is stimulated. P53 will stop, arrest this checkpoint. DNA repair occurs. If you can see here, see if damage in the DNA is found, cell cycle is paused to repair the damage. Okay, replication is stopped. If repair is done, replication further carried forward. And until the last stage, you can see all the spindles are formed properly. If spindles are not formed properly, again it will be stopped here. So before the stage of mitosis and complete mitosis, everything checkpoint will be there. So now I know what I need is to improve my checkpoints. I also know I can stop the cyclin dependent kinases. I also know I can improve the P53 pathway. By this, I can repair the DNA damage. Okay. So there are herbs which are working on it. Okay. Let us see how we can go further. I hope it is clear and it is not very complicated. If it is, just let me know. Okay. हेलो मैं लेक्चर में बाद में बात करता हूँ. Okay, so this P53 is a Tata molecule, okay, stimulated by DNA damage, hypoxia. So ask patient to do pranayam. hypoxia agar hai, so the cell cycle is DNA get damaged. So if they are doing proper pranayama, DNA will not be damaged and PA53 will not be produced. So hypoxia, nutrient deficiency, oncogenic signaling, oxidative stress, all these things, they can stimulate, modulate the P53, okay, and which can kill the cancer cell by various ways like ferroptosis, apoptosis, necrosis, and necroptosis. And if the DNA repair is done, normal proliferation can occur. Okay, so this is how you can see in this slide that P53 stimulates cyclin-dependent kinase inhibitor. Cyclin-dependent kinase inhibitor acts on this cyclin, okay, and cyclin will not work on cyclin-dependent kinases and cell cycle will be arrested. Not very difficult, just concentrate, you will understand easily, okay. So again, this what are the factors which kill cancer cell? Once the P53 direct the cell to kill it. So these are the apoptotic molecule, BAX, BAT, BEAT, BOC, no need to remember the short form, the full form of that. And in cancer, what happens? These pro-apoptotic molecules are not working properly. And anti-apoptosis, which makes cancer cell immortal. We say that cancer never die. Even in Ayurveda, it is said that cancer cells never die. I will give you the reference. So anti-apoptotic molecules, they are working in cancer, and because of which cancer cells are immortal. So now I know certain drugs which will reduce this and which will improve pro-apoptosis. Again, Gilo is one of the drugs, okay, which improves pro-apoptosis, all these proteins, and because of which cancer cells are made to die, they are made to do suicide. Okay, so these are all responsible bureaucrats for the abnormal growth. I have just mentioned it. Whenever you have time, you can go through it. Transforming growth factor, hepatocyte, receptors. So these are the receptors where I have told Rahul that this is a Dravya Gun classes, so I need to give mode of action. So where I'm working on growth factors. I'm working on receptor. Which receptor? Tyrosine kinase receptors, G protein coupled receptors, steroidal receptors, mammalian target of rapamycin, mTOR receptor, HER2 receptor. So there are herbs which are working on this receptor. These have been established. There are transcriptor factors which are they are the transducer, and they inform nucleus for the growth or for the inhibition. So there are various herbs which work on this. Okay, transducer factor. Okay, then these are the molecules: mitogen associated kinase, PI3K kinase, AKT, serine thiorein kinase, cyclin. So on these molecules, our herbs work very well. Simple fasting, it prevents the oncogene stimulation. So RAS, which is activated in 25% of the cancer, rat sarcoma is the name of that RAS. Okay, nothing to do with the rat. It was invented and then it was given the name RAS. So simple fasting or intermittent fasting, will suppress these oncogenes. Okay, so how many mutations? As I said, almost 3 to 4 mutations are required to become malignant. Okay, once it becomes malignant, cancer cell proliferation, they keep on growing it. Once they grow, they need a place to grow outside. So there is a invasion and spreading of the other tissue. First, there is an uncontrolled growth, and they need to pass from their system to the other system. Okay, plus they also need a nourishment. So cancer cells, they have a lot of small fragile capillaries, what we call angiogenesis. So these capillaries, they nurture the cancer cell. Okay, and through these capillaries only the cancer cell proliferate and go to somewhere else. So now I have a drug like Ashwagandha which blocks this angiogenesis. So cancer spread will be arrested. Okay. Now there are certain things like growth factors and anti-growth signal. So growth factors are stimulated in cancer, because of which they don't die, as you can see. Apoptosis and senescent death means the death as person become older. So this cell never become old. The cancer cell is always young. Okay, so there are certain medicines like Chitraka or Vidanga which block cancer specific growth factors. Okay, so cancer cell die. Okay, then this is as I said, they are spreading into the blood. So there are certain medicines which bind the circulating cancer cell genes. For example, copper resveratrol combination, which is tried in Tata hospital for 10 years, 1 decade. Okay, and they found that if you give copper resveratrol combination, this circulating genetic material of cancer is trapped and thrown out. Okay, so these are the various kind of stages of cancer. Okay, and we can arrest by having different kind of medicine. Okay, now what are the hallmark pratyatma linga of cancer? Okay, now you will be surprised, friends. In Sushruta, there is a word called Arbudadnya. Sushruta has written 500 years before the Christ, okay? And Journal of Cancer Discovery 2022, American Association of Cancer Guideline. These are matching the Pratyatma Linga or hallmark of the cancer written in Ayurveda and written in this 21st century. They are almost the same. So what Ayurveda or Sushruta said that Gramya Ahara, excess amount of sweet and processed food, Madhura Rasa, Acheshta, Staulya, Marmaghat, okay, Garavish, toxins. Toxin doesn't mean always the Sarpa vish or Bichuka vish. Your tobacco, your pollution, your pesticides, your smoking, your alcohol, your any kind of deeply fried food, okay, they all come under Garavisha. Then Vardhakya, okay, elder, as the cell becomes elderly, it loses the control. Then इन सब से samurchit मंद धात्वाग्नि जन्य शोथ, your agni, your cellular metabolism, Sattva is reduced, okay, and that generates a kind of inflammation. This is what a pathology written by by Sushruta Charaka or Ayurveda side. So Ayurveda Tadnya. What is written here that there are non-mutational factors. We always feel that cancer is genetic, yes, but we will see in the next few slides that cancer is not only genetic. There are non-mutational factors and mutational factors. So what are the non-mutational? That is epigenetic factors. So you can directly hit to the gene. There is something called epigenetic. There is a DNA methylation, acetylation. Okay. Once these happen, then only your genes get mutated. And who causes DNA methylation and acetylation? Is infection, diet, alcohol, tobacco, obesity, hypoxia, okay, senescent scent, that is a Vardhakya. They all actually first cause epigenetic changes and then there is a mutation. Further, this in this induces, this stimulates metabolic reprogramming. Okay, and because of this metabolic reprogramming, cancer cells keep on proliferating. Now that cell is working in such a way that it will produce excess amount of raw material to nurture cancer cell only. Okay, so this is the like one and two kind of what we call hallmark. Dhatu vruddhi mahantamah. Okay, this is Charaka Shlok or Sushruta Shlok about Arbuda. So Dhatu Vruddhi Mahantamaha, uncontrolled growth. Analpamulam. So there is a continuously deep-rooted growth is keep on going on. That also indicates angiogenesis. Vruttam Sthiram Chira Vruddhi. They are round. They are fixed. As we know, cancer cells, cancer tumor growth, the cancer gland is very fixed, stony hard, okay, because of the number of cells are more. And as you say, Ayurveda also says chira vruddhi. Chira vruddhi, when we say chira bhava, chiranjeev bhava means that you never die. So cancer cells, they are chronically increasing, they are immortal. So what modern science says that cancer cells have replicative immortality. They don't die and they generate a generation which will never die. Apakam manda rujam. So it's a slow growth. That's why it evades the immunity. Once the immunity comes into the play, there will be inflammation. So it's a slow growth. They evade immunity. So this is a sign. This Pratyatma Linga is a sign, or the considers that there is an immune evasiveness, non-acute response. Adhi arbudam, dvi arbudam, kalantarahi asadhyah. So adhi arbudam means वहां एक बार जहां कैंसर हुआ है वहीं पे दूसरी बार हो गया, या दूसरी जगह पे हो गया, जहां पे है वहीं हो गया दूसरी बार, या एक साथ में दो बार हुआ, दैट इज कॉल्ड द्विअर्बुदम. सो इट्स अ इन्वेसिव मेटास्टेसिस, रिलैप्सिंग. सो दीज आर द replica of this Sanskrit word. And kalantaray asadhyah, so they are chemo resistance. Okay, and phenotypic plasticity. We know that now various work is going on genotype and phenotype, and to find out which kind of cancer and which kind of chemotherapy will work for that. So based on that, the treatment is given, genotyping what we call. So in Ayurveda, as I said, Vat, Pitta, Kapha, Rakta, Mamsa, Meda, Sachajo, these are the different kind of, cancer are described in Ayurveda. In previous slide, I have already told you how Vat, Pitta, Kapha has to be treated, Rakta dosh has to be treated. If there is excess of Mamsa Dhatu, you can think of, giving a chikitsa which is written in Mamsa Dhatu Vruddhi Roga. Similarly about Medas. Chikitsa Karshan, okay, give some, what is written in Ayurveda, give some medicine which will debulk, which will reduce the some growth, some tissue of the cancer, followed by Shastra Karma by an expert Arbudadnya. So I'm sure at that time also cancer specialist must be there. Followed by Agni Karma, so that you burn that area and cancer will never again, whatever is left, that will be burnt out. This is very similar to your radiation treatment, and protocol seems to be same. And then you give rasayana to improve the immunity so that cancer doesn't recur. Now our rasayana and modern immunotherapy, they are two different things. Okay, so don't misunderstand that rasayana and immunotherapy are same. No, they are absolutely different. We will discuss sometime later. Okay, so chemotherapy, surgery, radiation, and immunotherapy I have just written to complete the protocol is the modern science protocol. In Ayurveda protocol, Karshan, Shastra Karma, Agni Karma, and Rasayan, wherein this Rasayan and immunotherapy are totally different. Okay. Am I clear, Rahul? Is it very boring or no? I don't know how many people are still there sleeping. Should I
So
continue?
wonderful.
Sir, I guess everybody's
The
there.
lecture is very nice.
Okay, Charlie, you are there. Okay, okay, okay. So metastatic. Now, cancers are always, what are the phases of metastasis? So cancer, as I said, it is known to spread. So it will commonest area to the brain. So somebody comes to you with the headache, all of a sudden headache. Evaluate properly, especially 40, 50, 60s age. Just don't mark it. Yeah, this headache is because of the pitta, or this headache is because of cervical spondylosis, or this headache is because of the dehydration. Understand what kind of headache, and you watch the pupil size, watch the plantar reflexes, how the onset of the headache is, whether it is early in the morning, whether it is in the sleeping, makes him awake. Look for the pulse. If the bradycardia is there, severe tremendous headache is there, along with that there are some kinds of episodes of passed out or some kind of vomiting, all of a sudden. And these are the patients you should pick up. Okay, वर्टाइगो, cerebropontine angle में अगर ट्यूमर है और वेस्टिबुलर ट्यूमर, a patient will come to you vertigo. So yes, there are out of 100 patients, 90 will have normal vertigo, but 10 they may have a cancer. So thorough examination is required. If you have a cancer, you should treat it immediately. Otherwise, cancer will spread and you will die. Simple clinical, look at examination.
Sir, Nitin sir, Nitin sir, Nitin sir.
मेरे को, हाँ.
सर सर तुमचा आवाज पूर्ण गेला होता. मध्यंतरी
बता.
नेटवर्क गेला
अच्छा,
होता.
so if there are lymph nodes, am I audible now?
Yes sir.
Okay, okay. Somebody comes to you with the cough, but the cough, the typical low pitch cough. Okay, so that also indicate that possibly pancreas tumor. If there is any hemoptysis, breathlessness, suddenly this patient is not asthmatic patient. Listen carefully. Do the percussion. If you find any kind of dull What about the stomach movement, stomach wall movement, chest wall movement? Have your eyes and ear open. Friends, honestly, you can diagnose clinically cancer and later on you ask for the investigation. If there is an hepatomegaly, jaundice, patient is coming to you, पीलिया हो गया. अरे, but at the age of 50 or 60, suddenly पीलिया कहाँ से हो गया? No, it is not always hepatitis, jaundice kind of अरे बाहर से खाने पीने से हुआ है. No, rule out if patient has got hepatic cellular carcinoma, cholangiocarcinoma. You have to pick up all these things properly. Okay, you have to be very, very vigilant. Somebody comes to you with a severe bony pain, severe bony pain. Why? Suddenly bony pain. No, it is not always because of the vata. It could be multiple myeloma. Somebody comes to you with a bony pain and you are asking for the calcium and calcium is very high. You are very happy. No, high calcium is bad sign. It could be multiple myeloma. Ask for the renal creatinine high, calcium high. My God, this could be a multiple myeloma. Rule out. Ask for the protein electrophoresis. Ask for the urinary, proteins. And if they are positive, then you are doing the. I have diagnosed two such cases. Two such cases. They were treated by orthopedic. Just simple. The patient had scapular pain. Typical scapular pain. है कुछ नहीं बोले वो cervical spondylosis, dorsal, and 1 month patient said severe excruciating pain. And I just observed him properly and asked for the simple X-ray, and X-ray shows lytic lesions in the scapula. And I could pick it up, and hemoglobin was anemic. Patient was having very low hemoglobin. So, sir, a person from the well-ate family, well-nourished family, why he or she should become anemic suddenly? And there is a sudden pain. Okay, so I investigated. I could pick it up. Two orthopedic surgeons missed it. Okay, two ortho because they are overburdened, and we don't have a lot of patients. We have a lot of time, and patiently I examined the patient, and I'm so happy that I could save his life. Okay, so these are the two patients. So skeletal pain. Suddenly somebody comes to you, कुछ नहीं थोड़ा सा लग गया और फ्रैक्चर हो गया. अरे यंग पेशेंट 25 साल का 20 साल का और थोड़ा सा लग गया और फ्रैक्चर हो गया. Impossible. Try to find out whether patient is suffering from chondrosarcoma, having sarcoma, or any kind of sarcoma. This kind of patient. घुटने पे सूजन है, थोड़ा सा सूजन है, वो खेल रहा था, सूजन आ गया. नहीं आना चाहिए. Do simple X-ray. Look for the periosteal lining. If there is kind of any shining is seen, ask for the MRI or talk to your good orthopedic surgeon who is working in the field. Like I said, Dr. Manish Agarwal, he is into the field. So I always consult him when I suspect such cases. Okay. So these are the things because cancer is picked up in the metastatic stage. So at least early metastasis you are able to pick up. You will understand and you will be able to give the treatment properly. Okay. So this, okay. So friends, ultimately this, DNA, oncogenes are there, tumor suppressor genes are there. So you need to promote tumor suppressor genes. You have to stop oncogenes. You have to do DNA repair. Okay, so that ultimately patient, DNA repair is properly taken care and he can live a normal healthy life. Now, coming to the main thing, what are the causes of cancer? ये black button निकाल यार, Rahul. Okay, so what are the
हाँ
causes
सर.
of cancer? ये ब्लैक बटन नहीं जाएगा ऊपर का, ये म्यूट स्टॉप वीडियो बीच
नाही
बीच में
सर,
आते
नाही
हैं.
सर, लॅपटॉप मध्ये ते नाही जाणार.
पण तुम्हाला पण दिसतंय का?
नाही सर, आम्हाला क्लिअर दिसतोय.
हाँ बस ठीक है. So what are the causes of DNA damages? So now, as I said, people feel that cancer is genetic, but see what is journal from Pharma Research 2008. Okay, only 10% of the cancer is actually genetic origin. 95% or 90% of cancer is because of the environmental causes. Now, environmental causes doesn't mean the pollution, air. Okay, environmental causes is a modern terminology they use for what? You will be surprised. 35% is because of the wrong diet. Okay, equal to almost 30% your tobacco. So यार तंबाकू और दारू हमेशा बुरी नहीं होती. इसका मतलब कल से पीना शुरू मत कर देना. Only 6% patients of alcohol, the alcohol is 6% cause. Tobacco 30% cause. Obesity, which is increasing now. Here it is 20% 2008. Now I think it will be more than 30%. Okay. So all these are 95% cancer is because of these environmental factors, which are like wrong diet, tobacco, smoking, alcohol, obesity, infections. Okay, only actual 5% they are born with the genetic mutation. So genetic mutation, yes, is the important step of cancer. But who is causing genetic mutation, whether it is somatic or whether it is inherited genetic? So 95% they have somatic stimulus, environmental stimulus, and because of which the genes are mutated. When I say this, I become confident because these things are under my control. When I say this, I know cancer is a metabolic disease. I can control the metabolism. Okay. So leave those 10% of the cases unfortunate. Even these cases, 10% of the thing, without having, the altered metabolism, the cancer will not nurture. So metabolism plays very, very important role in cancer. Now, what is written in Ayurveda, as you can see, causes of the cancer. See, cancer is a low-grade inflammatory disease due to improper or no panchakarma. Okay, although I don't do panchakarma, but I always advise patient to do sort of panchakarma kind of thing so that all body toxins are washed out. Prolonged fasting is bad, especially Vata Prakriti people should not do fasting. Prolonged illnesses are bad. Excessive salty, sour, heavy food, all kinds of processed food, excessive sweet, santarpan. So cancer, according to me, fits into santarpan janya vikara. Most important thing. Okay. Yesterday, Dr. Mehta also said Santarapanjanya Vikar. I agree. Cancer is totally in today's life is because of the Santarapanjanya Vikar, Santarapanjanya diet. Having excessive amount of curd, having improperly cooked food, all these things they stimulate DNA repair. They cause DNA damage. Non-compatible combination, infected food, toxic. Now, non-compatible combination, हम लोग रोज सुबह चाय पीते हैं. But when you add milk to the tea and boil, all the flavonoids in the tea are gone, and those flavonoids are anti-cancerous. So you're depriving patient, चाय पी रहा है लेकिन चाय में का सब पूरा घुंडा सब निकल गया. So plus you are supposed having milk and all kinds of fruits. So it produces a high molecular weight glycoprotein, which is called ARM. Adhesion molecules are increased. So cancer adhesion increases. Okay, molecular adhesion increases and cancer will spread. No exercise, no grahani. Okay, so irritable bowel syndrome is not only grahani but having imbalance, bacteria probiotic in your tummy also leads to the cancer. So correcting probiotic, the commensal bacteria, what we call in the large intestine, also is important. Provided you should not give this probiotic if patient is on a chemotherapy. Understand this. Once chemotherapy is complete, then you can give probiotic. Then injury to vital organs like kidney, brain, liver, that can cause cancer. Abnormal multiple deliveries can stimulate cancer, multiple abortions, and low immunity. Now, see, this is an important fact sheet from National Institute of Health, National Cancer Institute, okay, from USA. What they say, even cancer susceptibility is gene is present in the family does not mean that person will get cancer unless coupled with this environmental factors. So it plays very, very important, role, environmental factors in the cancer. So according to me, cancer is Santarpanjanya Vikar, causing Strotorodha, causing Vimarga Gamana, and ultimately depletion of Dhatu, Oja, and Prana. Okay, so this is what cancer is according to me. Okay, Rahul always questions me, sir, do you have any evidence? मैं क्या बात कर रहा हूँ? ये रहा evidence. DNA mutation may not be the cause of cancer. Cancer as a metabolic disease. So these are the journals, latest journal 2017, 2020 के सब ये journals है, आप दे सकते हैं. Clearly, author has written that DNA mutation alone is not the cause of cancer. Metabolic changes, dysfunctional metabolism is the root cause, is the driver which actually stimulates the mutation. So first there is a metabolic, dysfunction. So metabolic dysfunction is the driver, passenger is mutation. Later on, mutation takes over and this dysfunctional metabolism supports nurturing the mutation. So you have to control metabolic, dysfunction. You have to correct metabolic dysfunction. When I say that, I become confident because I know how to control and how to improve metabolic dysfunction. just for this thing, understanding that this is the normal cell, whatever food you are taking, the glucose basically undergoes glycolysis, produces two molecules of pyruvate, which produces acetyl coenzyme A. This acetyl coenzyme A enters into mitochondria. In mitochondria, in the Krebs cycle and electron transport chain, along with the oxygen, this glucose acetyl coenzyme A undergoes oxidative phosphorylation and through catabolic pathway produces 1 gram of glucose produces 40 molecules of ATP, that is adenosine triphosphate, your energy. It produces, generates heat, thermogenesis, very essential, okay? Reactive oxygen spaces hydrogen, and hydrogen oxide is water and carbon dioxide. And it produces various substrates for the biosynthesis like amino acids, fatty acids, nucleic acid, which are required to nurture your body, to build your body. What happens? So there is a damaged mitochondrial glycolysis. Okay, so mitochondria is not working. Krebs cycle is not working properly. Electron transport chain is not working properly. There is a reduced oxidative formula phosphorylation. So there is a fermentation. This acetyl A, which is supposed to enter, it again goes back into the cell and undergoes fermentation. That 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 produced converted into the lactate. Okay, see, so reduced catabolic pathway, it produces a lot of lactate. This lactate dehydrogenase converts most of the pyruvate to the lactate. This is outside the mitochondria. And only two ATP molecules are produced. Lactate is used or produced, and this lactate, which is like an armor, gets surrounded around the tissue and does not allow the immunity to work. This lactate inflicts the other cell and stimulate cancer process into that cell also. So Krebs cycle, it resends the citrate to the cytoplasm, fatty acid, and there is excess amount of production of, so catabolic pathway is reduced and body is now producing excess amount of fatty acid, amino acid, nucleic acid. Okay, because this mitochondria is not working properly, the acetyl coenzyme sent back to the cell where it undergoes multiple division and more amount of fatty acid and everything is produced. Even in the mitochondria, Krebs cycle, it produces excess amount of, this Krebs cycle produces excess amount of amino acids, fatty acids and nucleic acid. And electron transport chain, which is responsible to produce ATP, it produces less amount of ATP. So now I have less ATP and more amount of raw material. I require, say, for example, 100 grams of raw material. Okay, 33 each, fatty acid, amino acid, and nucleic acid. But body is produced 200 grams of raw material. Okay, now what to do with excess amount of raw material? Okay, so now mitochondria is giving signal to the nucleus that, boss, I have excess amount of raw material, now you have to use it. So nucleus is compelled to its newer metabolic state and becomes proliferative. So what nucleus will do? Okay, we will use it. So what it will do? It will fasten the G1 cycle, G1 phase. It will fasten the S phase. It will fasten the G2. It will fasten the mitosis. So it will stop all the checkpoints. It will stimulate all the growth receptor. It will stop the apoptosis. Okay, so with that, cancer proliferation occurs, abnormal cellular proliferation occur. It will stop the oncogene suppressor and tumorogenesis will occur. I hope this is very clear to you all. Am I clear, Rahul? This is very
Yes, sir.
essential to understand. Yeah. So
Yes, sir.
now, because of the excess material, raw material, nucleus is stopping the checkpoints, body is proliferating, and body is, surrounded with lots of lactic acid. Other cells are also infected. Okay. And this is because of the wrong metabolism in mitochondria. Okay. This nucleus and mitochondria, they are constantly talking to each other. Nucleus says, I want energy, I want raw material. So mitochondria will consume food, oxygen, and will give it to the nucleus back. Okay, so this kind of cross talking is constantly going on from mitochondria and to the nucleus. there are certain herbs which stop this cross-talking between mitochondria and nucleus, and also from one cancer to the other cancer. We will see which drug is that herb is done. So stopping the cross-talking between the unhealthy cells also will prevent the cancer spread. Okay. So see, you can see that there is an oncogenic transition of the cancer because of the smaller mitochondria. They are because of the hypoxia, infection, radiation, pollution, pesticides. First, these environmental factor will affect mitochondria. Friends, in a cell, there is only one nucleus, but there are almost 400 to 100 mitochondria are there. There are many majorly are working. Okay. So first pollution, pesticides, all these things will first affect to mitochondria. Their mitochondria become smaller and smaller. They are not able to produce enough energy. There is a more production of anabolic pathway. Okay, and ultimately activation of cytosolic calcium and calcineurin, and there is a altered what I said that epigenetic changes occurs which causes altered nuclear gene expression, and ultimately this cell become cancerous, and this is called oncogenic transition. So if I'm able to correct this mitochondrial excess fission, see this is mitochondrial division 1, okay? So if I'm able to stop the the division of mitochondria, whenever we eat food, mitochondria elongates, okay? It absorbs everything. But if they are not able to do it and they are smaller and smaller, they will not be able to produce. The Krebs cycle will send acetyl coenzyme into the cell again. Fermentation, lactic acid production will increase. Anabolic pathway will increase further. Okay. So this is how cancer process and oncogenic process has been started. Okay. Damaged mitochondria, abnormal. I am summing up. Oxidative phosphorylation, reduced catabolism, less ATP, more anabolism, more amino acids, nucleic acid, fatty acid, reduced thermogenesis. Why there is no inflammation? Why cancer cells, why this growth is cold to the touch? Because there is no thermogenesis. Plus, because of the excess amount of lactic acid, immunity cannot play a role. So there is no acute inflammatory response. Okay. Plus, nucleus is suppressing all kinds of apoptosis and stimulates growth and proliferative signaling, mTOR receptors and everything, all kinases, they are stimulated. Your P53 is suppressed and cancer process is started. Okay, see this is the epigenetic changes, methylation, phosphorylation and DNA this acetylation, which causes altered gene expression, and metabolic reprogramming, producing excess amount of one carbon metabolism, excess amount of amino acids and everything is produced, and cancer is set into the body. Environmental agents, nutrients, they all stimulate in a wrong way through the mitochondria. Metabolic reprogramming and cancer process starts, causes these epigenetic changes and altered gene expression, and cancer oncogenic process has set into the body. Okay, so this is the journal. Fantastic references that all 6 stages like initiation, growth, survival and metastasis, they cannot happen without the support of mitochondria. Okay, so mitochondria supports of tumorigenesis. Okay, now, this wonderful trial was done. What they did that this is a normal cell, this is a cancerous cell. Now, if say someone says that cancer is because of the, say for example, Rahul is saying that cancer is because of the abnormal nucleus. So what Dr. Chavi will say, okay, so what Dr. Chavi has done, Dr. Chavi has taken out this abnormal nucleus, cancerous nucleus, and inserted into this healthy cell, which is having healthy mitochondria. And what is the outcome? Outcome is that because of the healthy mitochondria, this cell is not turning into cancer. So Dr. Rahul is surprised. So let us prove it in another way. We say that cancer, again, so what Rahul has done to reconfirm, it has taken the healthy nucleus and put into the cancerous cell. Okay. And what again, to his surprise, found that because although they have a healthy nucleus, but mitochondria are not normal, this continue to become a tumor cells, or there is a death of that cell. Okay, but this continues to have a tumor cell. Now this trial was done 3 to 4 times. The last was published in I think 2021 or 22 also. So what the scientists came to the conclusion that the results suggest that tumors do not rise from nuclear genomic instability, but because normal mitochondria can suppress tumorigenesis, and mitochondrial dynamics clearly play important role in all kinds of cancer, and crosstalk from non-cancerous mitochondria can inhibit tumor properties. They are planning to mitochondrial transplantation. I don't know when it will happen, but because see, in a tumor, there are epithelial cells and mesenchymal cells. Mesenchymal are all cancerous, epithelial are normal. So, turning epithelial into mesenchymal, okay, so this causes cancer. So, what they are trying to take out the good mitochondria and implant and see the outcome of that. Those who are chemo resistant, so if they have more amount of mesenchymal cell, if they have more amount of dysfunctional mitochondria, they will be more chemo resistant. So in a given tumor cell, they are say for example 80% cells are mesenchymal, they will be chemo resistant. Okay, but only 50% are mesenchymal and 50% epithelial, they will be a good responder. So this is how mitochondrial dysfunction play a very important role, not only in the process of cancer, but also in the outcome of the cancer. Now, how to improve this mitochondrial function? Now, so that's why scientists are now planning to improve the mitochondrial dysfunction. So these drugs are called mitochondrions, which acts on the mitochondria. Ultimately, what is mitochondria? Now, let us come to that point. So mitochondria, which is the one which is, takes care of the cell function. It is responsible for cell generation. It is responsible for cell death, because mitochondria, when senses that cell is not working, it will generate a death signal, and that death signal causes apoptosis. Okay. Now these are the same, absolutely word to word same properties of your Agni. Mitochondria we inherit from mother. Okay, even Agni we inherit from mother. आर्तवम आग्नेयम शुक्रम सौम्यम. अगर हम स्पर्म की बात करें तो स्पर्म के हेड में जो फर्टिलेशन करता है उसमें माइटोकॉन्ड्रिया नहीं रहता, नेक में रहता है. नेक doesn't go into the ovum, it's only sperm head which enters, penetrates into the ovum. Okay, so mitochondria and Agni both are inherited through mother gene only. So if mother food is not abnormal during the pregnancy, okay, definitely that child will be susceptible to have cancer. Okay. Agni is responsible for all kinds of cell function. Agni is responsible for birth. Agni is responsible for the cell death. So each and every function of mitochondria is equal to your Agni. Okay. This is what a Sanskrit slok is. आयु वर्ण बल स्वास्थ्य उत्साह उपचय प्रभा ओजो तेजो अग्नि देह अग्नि हेतु कहा शांते अग्नो म्रियते युक्ते चिर जीवति अनामय रोगी स्यात् विकृते Agni Moolam Agni Tasmat Niruchate. Okay, we all know about this. In cancer, what happens? This Agni never dies, but this Agni is constantly abnormal. So it will keep on producing abnormal cells. There is a Dhatvagni Mandya and a chronic Dhatvagni Mandya. If Agni dies, the person or the cell will die. So what you have to do? You have to actually kill the abnormal Agni. You have to kill actually abnormal Agni, and you have to improve the healthy Agni. This is the role of Pachan and Dipan. Okay, the Pachan will do all Ama Pachan, and Dipan will improve your healthy Agni. Okay, this is what I understand, I perceive, and I am practicing accordingly. Okay, so improve the Agni function. So mortality will increase of the cancerous cells, and immortality or the healthy cells will have a senescent death, normal death. Rogaha sarve api mandegno bhavacharak. Now, what is written in this modern science journal? That mitochondrial dysfunction damage is the root cause for metabolic dysfunction like diabetes, obesity, cancer, abnormal inflammatory diseases, aging, apoptosis, pulmonary fibrosis. So all the diseases now they can be encompassed in a one single entity is mitochondrial damage. Mitochondrial damage could be because of the mutation, like born. 5 to 10% people are born, or 95% people, this mitochondria is affected because of the environmental factors. So this is clearly, the concept is similar with Ayurveda. Now, when we say about this, so Sanchaya Prakopa Prasara Sthana Sanshray Vyakti Bheda, these are the Shat Kriya Kal. So accumulation of oncometabolite inside the cell. So the cell is still not oncogenic, but there is an accumulation of all those things which causes epigenetic, the changes. Then there is a loss of tumor, loss of suppressive factors. Body has produced a lot of anabolic material has been produced. So what ultimately nucleus will suppress the anti-tumor process and tumor cells will start growing. Then there will be proliferation. They will grow angiogenesis. Then they will reside into the tissue where they are growing plus other tissue, invasion and colonization. And ultimately they come to you in the expression phase, severe headache or severe like dull cough or severe body pain, what I said, expression. We should be lucky enough to, pick up cancer here. So number of marker studies also help to pick up cancer in an early stage, and extensive spread meds, nothing can be done. Patient may die with that. So emerging evidence for targeting mitochondrial metabolic dysfunction in cancer therapy. This is again 2018 journal. Again, this is the latest journal. So mitochondria you have to target so that you get the good outcome. Now, what are the treatment in Ayurveda which improves the mitochondrial function? So simple. So now cancer has become simple to treat. All of you can become a cancer specialist. Okay. So fasting. Okay. My guru, Dr. Devshan Gala, he taught me fasting. So fasting is the first treatment. I will show you how it is very useful. All kinds of tikta medicine, kalamega, chiraita, okay, piperine, curcuma longa, ginger, ashwagandha. These are all medicines which act on mitochondria. Now, friends, see on your right hand side, arbuda. Excess use of sweet causes arbuda. Okay. So, अधिक प्रमाण में मीठा नहीं खाना है. Okay. Sweet sugar nurtures cancer. And bitter herbs, they are known to reduce pitta, cough. They reduce and they also reduce inflammation. Okay. That's why bitter herbs are very important in cancer. So whether herbs correcting Agni will modulate mitochondrial function, this is the question. I have established that Agni and mitochondria are same. I have established that if you improve mitochondrial function, cancer will improve better. So now I need to see whether drugs acting on Agni will improve mitochondrial function. Let us see. Now this gentleman, Dr. Oshumi, he got Nobel Prize for research on fasting, and he said that if you do once in a week fasting, okay, autophagy. So during fasting, what happens? Body cell, they use all intracellular debris, the all non-functional organelle, kills them, takes out the energy and uses. Okay, so excess amount of free radicals are also not produced. If you do proper fasting, diabetes, infectious diseases, you can keep all those things in the bay. So this he got Nobel Prize in 2015. I was going to my teacher 1990 when I finished my BMS and then about to enter my MD. I have seen result of fasting with my sir, Dr. Devchan Gala. He's practicing at Matunga. If you're lucky enough, you will get an opportunity to meet him and work under him or get guidance from him. So he has proven so many cases, especially of the rheumatoid arthritis, that how fasting is useful. Okay, total fasting. I was surprised when he used to give total fasting to the high grade temperature 103, 104. And I said, sir, how come my patient used to be better in 1 day or 2 day or 3 day? So it really requires jigger. And I'm trying my level best to follow his footsteps. Okay. So he is actually the person who deserves a Nobel Prize or at least, Padma Bhushan in our India. Now, westernized diet increases chances of cancer. This is Journal of Nutrition Biochemistry. And Langhan Dipan Pachan, okay, they improve Agni mitochondria. Let us see how. Simple one experiment, outcome of fasting. Friends will be surprised. Calorie restricted fasting, intermittent fasting, alternate day fasting, short-term fasting, and long-term fasting. These are the full form. There is no medicine which can do 36% reduction in the metastasis. Just simple fasting will do the down regulation of metastasis. Insulin right growth factor is signaling is affected. Interleukin 6, inflammatory molecule, tumor necrosis factor, C-reactive protein, all they come down because of the fasting. They upregulate P53 pathway. They upregulate all apoptosis pathway. Okay. Tumor growth, this is published in Tumor Growth Oncogene Journal. The fasting improves mitochondrial biogenesis. It improves healthy mitochondria. It unites those mitochondria which are separated from each other. It increases autophagy in the healthy cells, increases apoptotic molecule. Errors in DNA replication are reduced. Reduction in the migration of toxic gut associated lymphocytes, okay, MALT. okay, and reduces cellular senescence. So one fasting gives so much of good result, but you have to do properly. Don't give over fasting to kapha vata person or vata pitta person. Give moderate kind of fasting. Give low calorie diet. Give langanatmak diet. Give protein rich diet. Don't deprive them. Cancer patients are protein deprived. So you can reduce carbohydrate. You can reduce processed food. You can reduce sugar, but give them just a minute. Call me after some time. I'm in a lecture. Yeah, yeah, yeah. Okay. So because of the fasting, what happens, where I was, yeah. So don't give over fasting to the Vata Prakriti and Vata Pitta. Give Laghu Ahar, give boiled pulses, give homemade paneer, give chana, give sattu ka atta, cow's ghee you can use. Dr. Seema Trivedi from Delhi, she makes wonderful cow's ghee and I use a lot. She nurtures cows through the Vedic method, as per the Vedic Paddhat, and she's providing the best quality of cow's ghee. Give in a small proportion. Those who are fasting. So, rukshata bhi nahi honi chahiye. So, if you do fasting in such a proper Siddhantic way, there are good outcome. In a later stages of cancer, fasting doesn't work. That is what my observation, because cancer cells are very smart. If you deprive them of carbohydrate, they will start learning to live on the protein or the fat. So you have to change. You have to be smart. Some days give little more carbohydrate, some days don't give carbohydrate. This kind of changes you have to do. Very useful in the early stages during the chemotherapy, but in the later stages doesn't work. So somebody comes to me at the age of 80, 84, I don't ask them to do a lot of fasting and all. Let them eat, and let them satisfy themselves, and let them have a peaceful death. These are the biopsy evidences that how fasting improves your mitochondrial biogenesis. They reduce the insulin resistance. They improve insulin sensitivity. So whatever I'm talking to you, friend, is totally evidence based. So fasting improves mitochondria. I have proven that mitochondria and Agni is same. So fasting will definitely improve your mitochondrial function, as it is written treatment for our Agni, Langan Chikitsa. Okay. So natural agents targeting mitochondria in cancer, they are called mitochondrias, but synthetic mitochondrias are very dangerous. They are full of side effects. So these are the herbal mitochondrias, andrographis, that is chiraita, ginger, berberine, ashwagandha, curcumin, and cissus quadriangularis. So these are the things, which are there. Now, when I say Agni is mitochondria, I should be able to give you some marker. So there is a one marker for mitochondria, that is 8 hydroxy 2 deoxyguanidase. So cancer patient, they have high amount of urinary 8 hydroxy 2 deoxyguanidase. Only one laboratory is doing, that is American pathologist lab, which is there in the Kulaba somewhere. I have not asked anyone, but this is the paper which I am sharing. So cancer patient, those who have high urinary 2 deoxyguanidase 8 OHDG, so they are more susceptible to develop proliferation and cancer. When you give ginger, the ginger reduces excretion of this 8 hydroxy 2 deoxyguanidase. And we know ginger, Agni Deepan, Maha Aushadha, Agni, it acts on the Agni. So again, we have proven that ginger useful on Agni, ginger useful on mitochondria. Outcome you can establish by showing that mitochondrial degradation product 8 hydroxy 2 deoxyguanidase reduces. Okay. So this is how ginger you should use it. There are various parts of ginger, how they are useful in inflammation, reducing interleukin 6, useful in pain and useful in cancer. Use it cautiously. Those who are having stomach cancer and having a tendency to hemoptysis or hematemesis, so you have to be very careful, especially ginger powder, which is very ushna. But fresh ginger, if you eat in a small quantity along with the ghee, it will be not having side effects. Okay, ginger's purified compound. So these are the all papers on the ginger. You can go through it. As I said, piperine, you know, very useful. It all acts on this cyclin dependency. It blocks cyclin dependent kinases. Why? Increasing P21, P27. So people use people group. Why not? So it actually acts on all your G1 and S cycle, whatever. Then you don't have to remember. Only remember that it acts on the cyclin dependent kinases and it blocks the cell population to this G1, S1 cell phases are arrested. Okay. So this is about piperine. Plumbagene, that is Chitraka. It restrains the hepatocellular carcinoma angiogenesis, okay, especially hepatocellular angiogenesis. Chitraka is very useful for HER2 positive breast cancer because this epidermal growth factor receptor is very active. HER2 is very active in this kind of breast cancer patient, and Chitraka blocks that HER2 receptor. So plumbaging, you see, this is the paper, suppresses the invasion of HER2 overexpression in breast cancer cells. So those who are having HER2 positivity, you use Chitraka with cautious. You can use Chitraka Divati of Dr. Nitin Goradia. It is very good. Or you can use Chitraka Gruta. No issue. Okay, then curcumin, wonderful drug on which we have been working for almost 20 years and seems to be a very good candidate. So probably this will be a next candidate by allopathic medicine as a chemotherapy, unless we all take up and do. See, mitocurcumin, they have developed a curcumin which acts on the mitochondria. It washes out all kinds of unhealthy mitochondria. Okay, so it helps body to regenerate the newer mitochondria. Curcumin is a pro-oxidant. Now understand the theory of oxidant and antioxidant. We ask patient to have antioxidant things, but no. If patient is on a chemotherapy, don't give antioxidant. Certain amount of free radical is essential to generate death signal. Okay. Cancer always will try to suppress that free radical to reach to that optimum level. Cancer will generate free radical which is essential for the cancerous growth. It crosses beyond that, okay, it will suppress cancer growth because it will make the cancer cell die. Okay, so curcumin actually through this modulation of thioreduction, I forgot the full form of this PXR2, it improves the free radical production, and that's why cancer cell die. The bitter leaves, पान जो हम खाते हैं, simple पान, कलकत्ता पान है, बनारसी पान, don't apply चूना कत्ता, simple दो पान अगर खाते हैं, that improves the free radical production to the optimum level so that cancer cell die. So curcumin can be given along with chemotherapy because it will not interfere with your chemotherapy. Okay. Now, okay, it actually makes cancer cell priming, okay, so that they become more susceptible and they die. Okay, vitaferin A causes apoptosis. Now, cancer, ashwagandha is a wonderful drug, which actually hits the cancer stem cell. Sorry. Okay. So ashwagandha with the chemotherapy, the all cells die, but stem cells do not die. Okay, ashwagandha kills these cancer stem cells, and because of which relapse is prevented. Ashwagandha can be given with sorafenib and other this chemotherapeutic drugs, and results are much better when only ashwagandha was given or only sorafenib was given. The necrosis was say 2%, but when both were combined, result was almost 89% more. Okay, 35% increase arrest in G2 phase. Okay, where the split actually occurs. So synergistic effect and lower requirement of sorafenib and decreases toxicity also. Okay. So ashwagandha and paclitaxel also work hand in hand. So these are the various way receptors and pathways ashwagandha and curcumin work. Okay. These are the various papers which you can go through it. Okay. Manjistha, another important drug, very useful. The modern pharmacological studies have revealed that Rubia cordifolia and derivative components have anti-tumor, antioxidative, anti-platelet and aggregation, and anti-inflammatory effects. Most studies are preclinical. So you need to do more clinical studies. This is how you pick up the drug. If any MD student is there, this can take this literature study and can work out. Okay, establish efficacy and work out. Okay, so you can talk to your college people if there are any students and they can work out on that. Now they have also developed silver nanoparticle with the help of Rubia cordifolia. I'm using silver nanoparticle, I'm using gold nanoparticle, which are different than gold bhasma and silver bhasma, and results are really amazing of this gold nanoparticle and silver nanoparticle, which are the patented molecule, unfortunately from USA. I'm having at a very high cost and using it. Okay. So see, as I said, the crosstalk between the cancer cell has to be stopped. So Manjistha is the one, the anthraquinones in the Rubia cordifolia, they stop the cross-talking between the unhealthy cancer cells. Now, Manjisthadi Kada is very useful. Somebody is of Pitta Kapha Prakriti, use it. If somebody is Vata Prakriti, use Mahamanjishta, the Dhruta or Mahatikta Dhruta, which is equivalent to Mahamanjishta. This is how you can use a Yukti Praman and use our drugs to cure or control cancer or at least to manage them. Okay. So these are the various papers on pharmacology. So nasopharyngeal carcinoma, it was found Rubia cordifolia, that is Manjishta. These are our trials which we have done in Tata Memorial Hospital. A clear disclaimer, though doctors from TMH are actively involved into the research on herbs and cancer, they do not advise to stop chemotherapy. So don't take me wrong, okay? These are given as an adjuvant. We have tried curcumin and ashwagandha in a very stage or 4-stage cancer. So no one survived with that. We only established the safety and efficacy. It was very difficult at that time, 2006 or 7, to find out a curcumin formulation which will have a good absorption, and no pharmacokinetic studies was done. So this was the long vida drug which we, and Ashwamax. So these are the two formulations which we have developed, which contain standardized curcumin and giving certain amount of, the blood plasma level of curcumin, blood plasma level of vitaferin A, and continuous usage of that definitely, comes down, brings down the cancer and makes them to die. Quality of life of the patient improves. This is definitely, I can tell you, from 2006, I'm using this long vida and Ashwamax of Farmanza Herbals. Absolutely standardized. Also, these are the export quality. Unfortunately, pharmacy is not selling this drug in India. They are only interested to sell in the Western country, whatever XYZ reason. Okay, so these are the trials which we have done. Bioavailability of solid lipid curcumin formulation was much better than other formulations. Okay, so you can see that we gave 4 gram of curcumin, of the solid lipid curcumin, above the threshold, required threshold of biological activity in the present study, and we found that this reduces TNF alpha, amyloid beta, and these are also useful for Alzheimer, okay, and for the cancer. So these are the clinical trial government identifier. Okay, this is the number. Okay, so these are all, those who are interested can go through it. You can see the curcumin curve which we are getting, okay, in the blood after giving 4 gram of curcumin, say after 1 tea or 4 hours of this. Although this is also less, but as compared to other formulation, you can see here what curcumin we gave. So there was a 650 milligram capsule. When it was given, it had 22 nanogram per ml. There was a blood, it was seen. But other formulation, there was nothing, not they are not present anywhere in the blood to this level. Okay, so this is how, the curcumin formulation we have developed. Similarly, we have used for the ashwagandha, and these are all toxicity studies. Those who are interested in that, they can go through it. This is a wonderful study they found. This was done in USA, and on the rat model of the glioblastoma, and there was a reduction in the of the cancer. Okay, so there was reduction in the cancer cell with the Ashwamax formulation. Unfortunately, the person who was died. His son had glioblastoma. He responded, and that's why he wanted to do further. But unfortunately, he also died of heart attack, or I don't know what reason. So we could not do this study. But there are other trials are done on this, and we found that these are published also, that how ashwagandha is useful, for various cancers. Ashwagandha has a beautiful effect in a bone marrow transplant. When we do for acute myeloid leukemia or other, we need to suppress the immunity so that transplanted marrow is not rejected. Okay, but cancer specific immunity is sustained. So ashwagandha for first 100 days, it will suppress only immunity which is going to reject the marrow, but cancer specific immunity is intact. So this was the dual wonderful effect of paradoxical effect of ashwagandha, and has been, published by Dr. Vikram Gota and all. Okay, so this is a beautiful effect of ashwagandha, dual effect of ashwagandha. Okay, these are the pre-cancerous stage, the cervical cancer, in which curcumin has worked beautifully along with the antibiotics. You can see the lesions are totally gone on the 10th week. We know that antibiotics do not cure cancer, but antibiotics were given to prevent the infection, and curcumin was given, and on the 10th week it completely vanished. Similar trial were done on the mouth cancer, buccal mucosa cancer, and results were very good. I have also worked on the cannabis, that is bhang, a lot. Okay, so there are various effects of bhang. It modulates mitochondrial function. epigenetics changes, what acetylation and methylation, it will prevent that. It prevents mitochondrial fission. It prevents the breakdown of the mitochondria and improves the fusion. It improves mitochondrial respiration. It improves mitochondrial biogenesis. Okay, it improves mitochondrial induced apoptosis. Okay, Dr. Syed Tahir Hassan from Kerala, he taught me about all the scientific knowledge of cannabis. I'm really thankful to him. Okay, and probably I have used cannabis a lot. Now this is the trial done acute myeloid leukemia, and the girl survived. Sorry, not this slide. Next slide. So these are the various ways to cannabis mode of action is there. This is our trial in Tata Hospital, and we have established that CBD and THC, they are effective in this 5 milligram of dose. Whatever this paper will be published shortly. But safety and efficacy we have established in Tata Memorial Hospital. I have worked with Dr. Pankaj Chaturvedi and more doctors. So there are 3 to 4 trials are going on safety and efficacy of cannabis on lung cancer, on the breast cancer, and on the head and neck cancer. Okay. So this, if you are interested how CBD and THC work, you can go through this all literature. Okay. So these are the ways it increases the cancer apoptosis, it increases autophagy, and it prevents the proliferation. This is how cannabinoid work. Okay. Epithelial to mesenchymal transition is arrested. Tumor angiogenesis is arrested. Invasion or metastasis is arrested. Just a minute. Hello. Yeah. So invasion and metastasis is also arrested by cannabis. Cancer specific immunity, this M1, is increased because of the cannabis. Cancer will drive your macrophages to become M2. You know, M2 is a silent macrophages. They will not kill cancer, they will not kill infection. But cannabis will turn this macrophage 2 to macrophage 1, and because of which anti-tumorogenic capacity is increased of your macrophages, and it kill cancer cells. So these are all the papers of cannabis. Okay, number of articles, clinical studies. It's only India we are lacking. Okay, this is again my trial in Tata Hospital. Slide thoda upar niche ho gaya. Okay, a wonderful trial was done. Acute lymphoblastic leukemia. This girl actually reached to the deathbed. She was chemo resistant. Bone marrow transplant was done, and there was no result. Chemotherapy landed her into the ICU, and she was given full blown this CBD treatment, cannabis treatment, and she survived. This was observed and confirmed by third party. So this trial has got a lot of weightage. It is not that it's done in my hospital and I am doing the observation. So someone else is, validating whatever results are there. Okay, so this is a wonderful study. You can go in details through this journal, cannabis effect in the terminal acute lymphoblastic leukemia. But you should have a good quality of cannabis, then only you will have a good result. I'm using Pillcraft CBD, that is solazan oil and all other drugs. Okay, so friends, in a summary, mitochondria is depicted as a structural and functional organelle of Agni. Deepan Pachan Rasayan for Dhatu Satmya is proven to be safe and have reproducible anti-cancer activity. Most important. Am I audible? Yeah. Okay. So our drugs, they improve mitochondrial function, they repair DNA, they improve DNA repair, they improve P53 nuclear factor, NRF, etc. by increasing cancer specific immunity, pro-apoptotic. All these things are improved because of our herbal remedies. This was the trial. Okay, so we all know that tobacco causes cancer. So 2 groups of the people, rats. So in one group they gave this tea, eugenol, cloves, and chiraita. Okay, and other group they did not give this tea made up of that, and they found that other group which did not receive, they developed cancer. But the rat which received this tea, they did not turn to cancer even after infusing them with the tobacco. It doesn't mean that we should ask patient to eat tobacco and have tea. No, prevent first, prohibit patient from eating that and give this tea so that whatever carcinogens are accumulated in the body, they will be expelled out. Friends, there are 35,000 plants were screened and 3,000 plants were found to have reproducible anti-cancer activity. If there are students in this lecture, they can definitely take help of this, find out, identify the herb and do research as your MD thesis. Okay. These are my number of cases on the cannabis. More than 2,000 cases I have with my proper data. I have everything is there in my pen drive. Okay, I have used it other than cancer also. Huntington, Korea, Myasthenia gravis, not a very happy result in motor neuron disease, but some kind of multiple sclerosis people, they have responded well. IBS, okay, dysmenorrhea, PCOD, diabetic neuropathy. There are no major side effects. Emails you get some giddiness or dizziness, titrate the dose slowly so there are no side effects. Till that, not a single patient out of 2,000 has developed kidney issue or renal failure or liver failure because of whatever drugs I am using, including cannabis. So as I said, Solazan I use a lot, Solazan 40 and Solazan 45, Odin Care and Trilocke Vijayavati, which is a Granthukta formulation. Odin Care is nothing but Trilocke Vijayavati in a double strength or triple strength. Okay, this I use for the pain, for the pain. These are all my cases successfully treated. After certain, because of my lethargy, I have not added number of other cases also. Okay. As I said, in Tata Hospital, we have tried copper resveratrol combination and it is found to be very useful. I am using gold nanoparticle and silver nanoparticle. If someone is interested, they can contact me in person. I will guide them further. Okay. So these are the things. So friends, coming to the end, okay, 1,300 people are dying. Okay, you ask patient to have chemotherapy, targeted therapy, but give Langan Deepan Pachan. Ayurgenomic application is very useful. If possible, you can all connect to me. I am going to conduct a course in the month of July on Ayurgenomics, which will be conducted by IIT Jodhpur and my Goregaon Medical Association, so that it will be a certificate course. You will understand how Vata curve is to be molecularly docketing to be done and what are the markers for that, why Nanatmaj Vikar are 80, 40 and 20, and so many things. Dr. Mitali Mukherjee, she has done tremendous job, tremendous work on this. We all Ayurveda doctors must learn this Ayurgenomics from her. So if you are interested, let me know, we will go through it. Okay. So it is easy to kill cancer, but the challenge is keeping patients alive. Okay, and Ayurveda can do. So, friends, I'm really thankful to you. We having a patience and listening to this, the very difficult and complicated topic. If you have any questions, or if you are still, awake, you can ask me.
Thank you so much, sir. I guess there are many questions. Just one
So I
minute.
want to see people. How can I see?
I request everybody to just switch on their videos so that sir can see us.
From where to see?
Sir, go to the participant.
Participant, yes, yes. And participant and okay.
और
And
सर वहां पे ना आपको लैपटॉप पे राइट हैंड अपर साइड पे ना एक ग्रिड दिखाई देगा, उसमें सर एक ऑल पार्टिसिपेंट्स का एक ऐसे कुछ फुल स्क्रीन ग्रिड है, आप उसमें क्लिक करेंगे ना तो इजी हो जाएगा.
साइड कंट्रोल एनोटेट AI कंप्रेशन नहीं है. न्यू शेयर चैट इनवाइट स्टॉप वीडियो. एनीवे, किसको कुछ पूछना है तो पूछ लो.
यस सर, चैट बॉक्स में सर कुछ क्वेश्चंस हैं. सर एक क्वेश्चन है, एनी ऑब्जेक्टिव मार्कर टू चेक द अग्नि ऑफ द पेशेंट.
दैट आई हैव गिवन ना 8 हाइड्रोक्सी 2 डीऑक्सीगुआनाइज.
ओके. So second question है, what are childhood cancers? Can they be categorized into संतर्पणजन्य और अपतर्पणजन्य?
No, childhood cancer basically they fall into mostly genetic origin. Acute myeloid leukemia और दूसरे जो कुछ भी है, mostly they are genetic origin. As I said, 5 to 10% of the cases. But you improve the diet and you improve the metabolism, they will respond. Yeah.
Okay, sir. And sir, does cancer have any correlation to Unmad?
उन्माद
Yes, sir.
नहीं, उन्माद से मैंने कोई कोरिलेशन नहीं किया। अर्बुद संतर्पण जन्य विकार तक मेरे को मालूम है, उन्माद से तो नहीं मालूम।
Okay, sir.
अपस्मार
So
एंड
the next,
एपिलेप्सी कैंसर के पेशेंट में हो सकती है बिकॉज ऑफ द ब्रेन ट्यूमर
okay, sir.
और ब्रेन मेटास्टेसिस।
Okay, sir. So the next question is how much extent is Kanchanar Google helpful in localized or benign tumors? Any
टू माय
clinical
पर्सनल
experience or data?
एक्सपीरियंस, टू माय पर्सनल एक्सपीरियंस जीरो।
Okay,
My
okay, sir.
personal experience, I have used 12 tablets per day for 3 months, 4 months, पर वो नहीं कुछ मेरा रिजल्ट।
Okay, sir. Sir, another question. How to do fasting during chemotherapy, IV or
Yeah, so
oral?
one trial was done, published again in the journal, short-term fasting and long-term fasting. So before chemotherapy, they gave, low-calorie diet. uh, a kind of porridge they was given, vegetable soup was given. So there was no oil, deep fried processed food was given, and they found that HFP was very high. Those who received chemotherapy, those who received fasting, which protected bone marrow to go from the bone marrow damage because of the chemotherapy. So hemoglobin WBC level did not go down. So they gave short-term fasting for 24 hours before chemotherapy. Certain trials are done there for 72 hours. So they continued it for 3 to 4 days with the same kind of protein-rich, low-calorie diet. And it actually helped to prevent side effects of the chemotherapy.
Uh, Thank you, sir. Another question. How much dose of CBD or full leaf extract to be given in cancer patients?
So CBD, now I used to use CBD and THC both, but now I don't use tetrahydro, this THC, because of the psychoactive effects. Become very difficult, when some patient को ज़्यादा psychoactive, psychosomatic जैसा हो गया था. Some uses a lot, but I use plain CBD and I'm getting good result of the CBD. So I use 45 milligram per ml. That is the dose. Okay. So I start with 2 drops, 3 drops, very small dose, and slowly increase so that in a one day patient can take 1 ml or 2 ml of CBD oil comfortably. And why CBD is to be used? What was the hypothesis? Dr. Badwe said that when what he found that during the breast cancer surgery, pre-operative surgery, so he has done the biopsy and he saw the cancer activity, how much it was. Now during surgery, so pre-operative biopsy, now during surgery, again biopsy was done and they found that cancer cells were almost inactive. So no medicine was given. So what was working is anesthesia. So this is his hypothesis that if you give some drug which will make cancer cell anesthetized, will make them to sleep for little longer time. Okay, so that will help cancer cell to they will not relapse. ओके, सो यू हैव टू गिव केमोथेरेपी के साथ में, केमोथेरेपी के बाद में या पहले अगर आप देते हैं सीबीडी ऑयल स्लोली टाइट्रेट में, सो कैंसर सेल एक्टिविटी, कैंसर सेल स्ट्रेंथ विल रिड्यूस ड्रास्टिकली. My role is very clear. I want to prevent the relapse. How to prevent relapse? To make cancer cells weaker. So cannabis is one of them. So use it. If they are able to, how to make them tolerate? Use small dose. Some patient may get little dizziness. Give little more water. Give limbu pani. That is the antidote for cancer. Okay. थोड़ा सा कड़वा लगता है तो थोड़ा सा हनी आप बाद में दे सकते हो, थोड़ा घी में दाल में मिक्स करके दे सकते हो. So my one patient, she is 6 or 7 year old young girl, and every month she used to get admitted because of the epilepsy. Now last almost 1.5 years, there is no single episode. She was on the 3 to 4 anti-epileptic drugs. Now she's on only one anti-epileptic drugs, modern, and this cannabis she's taking almost 18 months, and her kidney, liver functions are absolutely normal. Now I'm giving just 0.5 ml once. Initially, she was taking 0.5 ml twice a day. I have 80 to 90-year-old gentlemen also, colon cancer. I have given rectal enemas of the sea. Of course, they could not survive, but they live for 1 year or 2 years, and they had a very peaceful death. So, these are the extreme ages also. I have used cannabis, and only CBD you use. This Pillcraft company ka CBD is very good. There are no side effects if titrated properly and used it.
Sir, how about
Uh,
Bohico? Sir, Bohico product, which is also a cannabis, they
Yeah,
have
you
given
can try,
extract.
but I have personally I am using this CBD from this Pilcraft.
so one question. So
Yeah.
with CBD intake, does the pain increases ever? अचानक से दर्द बढ़ सकता है
I have not
ब्रेस्ट
observed
कैंसर?
such kind of thing. Paradoxical. No, no,
Okay,
no.
because I had a patient of breast cancer, and to reduce her pain, I had given her in 3 drops per day. But she complained within second day that no, I am getting too much of pain. Should I stop? So
Probably she
since
may
it
be
was the
of a
first,
Vata Prakruti, and she may require a higher dose. Possibly. That would be possible.
okay, sir.
Yeah.
Any other questions? Anyone?
Okay.
Okay, thank you so much, sir. Thank you so much for enlightening
Thank
us on cancer. And I think most of us were very much unaware of many things in regards to cancer, its management, and all. And hopefully, now we would be able to be much more precise and I would say have an understanding while treating those kind of patients. So, thank you so much
thank
from on behalf of everyone for enlightening us on this topic. And thank you so much, sir, once again for sharing your knowledge.
thank you.
Thank you.
Thank you. Thank you. Okay, we are in time finished. Thank you very much. Bye bye.
Yes, sir. Thank you.